yet another edition of the Mind and Heart webinar series. And as always, my name is Benjamin Labi. I'm the head of the communications unit at Regent University College of Science and Technology. The Mind and Heart series is a webinar series dedicated to promoting mental health and emotional well-being. So that's a bit of a background on the webinar. So the webinar brings together leading mental health practitioners, educators, professionals, and students, and offers insights and key learnings in the field of mental health and emotional wellness. So the webinar series covers everyday issues related to mental and emotional well-being with interactive sessions, and as you see today, a live interactive session with practitioners. So you could ask any questions you want to ask on mental health related issues. So for today's edition, we are privileged to have as our speaker, Dr. Evelyn Owusu-Roberts, who's a licensed clinical psychologist and also a faculty member with the Department of Psychology at Regent University College of Science and Technology in Accra, Ghana. And the topic for discussion today is healing from trauma, strategies for coping and moving forward. That's healing from trauma, strategies for coping and moving forward. And I've had some conversations with our speaker, and I can assure you that today's session will be nothing short of impactful. So our speaker will speak for about 30 minutes, after which there'll be a 10-minute question and answer session. So if you have any questions you would want to ask bordering on mental health, bordering on the subject for today, or the presentation delivered by the speaker, you could drop your question in the in-chat feature. So there's an in-chat box feature that you can drop your questions there, or you can simply wait for the end of the presentation to ask your question. At this juncture, I would jump into the profile for our speaker, Dr. Evelyn Owusu-Roberts. Dr. Evelyn Owusu-Roberts is a psychology lecturer at Regent University College of Science and Technology and a licensed clinical psychologist. With her extensive expertise, she frequently serves as a panelist on radio and TV shows, enlightening audiences on issues bordering on psychology and mental health. Her passion lies in applying the concepts and principles of psychology to enrich everyday life. Dr. Owusu-Roberts mentors and guides students as they navigate their post-university journey. As part of her practice, she helps clients to communicate impactfully and effectively through verbal and nonverbal communication. Beyond her professional pursuits, she is deeply committed to the empowerment of individuals in their journey towards living out their best lives. She is particularly proud of her Christian faith and passionate about God. Notably, Dr. Owusu-Roberts is not only a thought leader, but also a creative writer. She's the author of 2 captivating novels, Breath of Faith and Against the Tides. So, ladies and gentlemen, let's welcome Dr. Owusu-Roberts. Over to you, Doc.
Thank you very much. It's an honor to be invited to talk on this subject. I will just go ahead and share the slides so that we can start. So, as Mr. Labi said, the subject for today is healing from trauma, strategies for coping and moving forward. We are going to look at a brief introduction. We are going to then look at some types of trauma. We'll look at some symptoms and features of trauma, some of the causes and risk factors of trauma, and then we'll look at the main thing, which is the coping strategies, and then we will conclude. So let's look at the introduction. What is trauma? So according to the American Psychological Association, trauma is an emotional response to a terrible event like an accident, rape, or a natural disaster. So the thing that we need to know about trauma is that everyone responds differently to trauma. What Two people might go through the same traumatic experience, but then there might be very two presentations or very two outlooks concerning how they respond to the trauma. Whether it seems easier for some people to undergo traumatic experiences than others is really shouldn't be a matter of shame. I'm thinking that maybe others have gone through similar circumstances and they are doing better than maybe you or that individual experiencing the trauma is. And when we look at the coping strategies, and we are looking at being able to get that healing from trauma, that work can be done individually. It is something that the person undergoing that trauma or traumatic response can, on their own, recover from or get healing through. At the same time, there's also those who may need professional help depending on the complexity of the trauma or the trauma response. Either way, it's important to know that there's no shame in seeking help if you need it. So let's look at some of the types of trauma. Here are a lot of different types of trauma. When you do a little bit of research, you find that um, you know there are lots of different types of trauma. Some of these definitions overlap, but then we are going to go through these different types of trauma. So the first one that we see on the left, the two types, the big trauma and the little trauma. I think for anyone who is experiencing that trauma, for their traumatic experiences to be labeled as little can be a little bit invalidating. But just know that it's just a way to a little bit differentiate between just how severe the traumatic response is, because that also impacts the level of treatment the individual may need. So when we are talking about big trauma, we are talking about very big life events, and we are talking about like instances like war, and we are talking about being through a natural disaster. So some of these very major traumatic events. Then we have little traumas, which tends to be a little bit more of that emotional response, maybe a little bit of an emotional abuse, maybe going on when it comes to feeling that trauma. When we are talking about bullying, for example, they may say that that can be classified as little trauma. Then we look at the middle part of this presentation, and we see the seven types. So with the seven types, we have the life transitions, basically the trauma that one might go through when they lose a loved one, for example. Then there's vicarious trauma. So vicarious trauma is usually experienced by those who care for people who have been through a trauma, or people who tend to see traumatic things over and over again. So, for example, even mental health care workers can have experienced vicarious trauma. So, while doing the work of trauma, counselors, mental health workers of any sort, hearing, really difficult, traumatic experiences over and over again can lead to one experiencing trauma themselves. If you even think about maybe people who work, first responders, ambulance, those who are in the ambulance service, maybe policemen who have to witness road accidents, all of these people, although they themselves may not have gone through an accident, or they themselves may not have directly experienced that trauma, just being around that situation or those situations for especially a prolonged period of time can lead to a vicarious trauma. Then we have complex trauma, which is the type of trauma that tends to happen, over and over again. So, looking at maybe an individual who may have repeatedly been raped or gone through some sort of sexual abuse over the course of their lifetime, or maybe even as kids. Then we have historical trauma. So when we are talking about historical trauma, a major example is looking at African Americans and the history of slavery. And so some of these issues would have been passed down the line. And so that's an example of historical trauma. Then there's intergenerational trauma. So we are talking about intergenerational trauma. This usually is the type of trauma that can be passed down the line within a specific family. So this also even makes it even more important when we are looking at the work of trauma and how it's important that we deal with our own trauma, because when we don't deal with our own trauma, we can pass it down the line, and how we respond to it, how we cope with it, especially if it's not healthy, can impact our family. It can impact our children, and then their children's children, and so on and so forth. That is why it's really important that the work of trauma is done, so that we don't go ahead and pass down that intergenerational trauma. Then we have collective trauma. So basically, when we are looking at collective trauma, this is the type of trauma that a whole bunch of people experience, at the same time. So, for example, when we look at COVID-19 and how this affected basically the whole world, that kind of trauma, some of the deaths that were experienced, just looking at that, the fear that could have risen out of that. Like, and during that time, there was a lot of fear too, and some people. A lot of people would not have responded to it very well. It was kind of a scary experience too as well. And so that is an example of collective trauma. Then when we look at acute trauma tends to be similar to the two types of trauma that we've already talked about. So usually it's like one traumatic event that has occurred, and it was just really impactful, and so the individual has that emotional response to it. Then when we look at the three types of trauma on the left, I've already explained what acute trauma is. It's a one-time event. Chronic trauma is the type of trauma that seems to be long-lasting. The effects of it is very pervasive. Years down the line, you're still experiencing that trauma. And then we have the complex trauma, which is a kind of trauma that's kind of like a mixture. You have traumatic experiences happening over and over again. So, when we are looking at, the types of trauma according to the DSM, or the Diagnostic and Statistical Manual, which is basically the Bible of mental health, conditions. One of them, basically. We have these types of disorders that are trauma that are classified as trauma and stressor related disorders. um, these are reactive attachment disorder, disinhibited social engagement disorder, post-traumatic stress disorder, acute stress disorder, and then adjustment disorders. um, there may be people who experience some of the symptoms of these types of trauma, but then it may not be so severe as to qualify as a disorder. So when it comes to some of the symptoms symptoms of these disorders, it is important to note that there is that kind of grade. It's a gradient. It's a scale. It doesn't necessarily mean that if you're experiencing some of the symptoms, you have a disorder. So I'm hoping that we are not going to be diagnosing ourselves here as we walk through some of these traumas. So, reactive attachment disorder and disinhibited social engagement disorder tend to be disorders that you see really during childhood. A reactive attachment disorder tends to be, you know, like a disorder that you find with children who haven't really had one significant figure, parental figure or caregiver, and so then they haven't really been able to rely or depend on that one person, and so because of that it's very difficult for them to receive comfort, when they are distressed, or to even seek out comfort when they are distressed. So when someone has reactive attachment disorder, it really seems like they can't connect to other people, especially to someone who should be in like a caregiver position. And so that connection really is not there. Disinhibited social engagement disorder is also similar. It also rises out of that same kind of situation where that individual didn't grow up with a single attachment figure or like a caregiver. Maybe they also had to move from place to place, so they were not really able to form that bond. And so because of that, the way in which they relate with people is a little bit disinhibited, in the sense that they're a little bit, you may say they're a little bit too free with maybe adults, and expecting a little bit of caution, in that relationship, especially when it's an adult, a strange adult, figure. You see that that is not there. Post-traumatic stress disorder and acute stress disorder, they are similar. The only difference is in the duration. So basically, acute stress disorder is the symptoms that you experience up to a month, after the tragic event or the traumatic event. And when it's from 1 month going, we say that you now have post-traumatic stress disorder. We'll talk a little bit more about that. But then I will move to adjustment disorders, which is basically an emotional and behavioral response to like a stressful situation, which could also be traumatic. And so basically, when I'm talking about adjustment disorders, maybe there's been like a change, maybe even the loss of a loved one, and the person is not really coping very well with that. And so maybe some sudden life changes that are also really traumatic, and that also causes some sort of an adjustment issue. Now, when we are looking at post-traumatic stress disorder, on the illustration on the right, and we see the symptoms of post-traumatic stress disorder. I will emphasize a little bit on this because this tends to be a little bit more common. And one thing that needs to happen for someone to be diagnosed with post-traumatic stress disorder, one of course, is that they have been exposed to the trauma. Whether they have experienced a car accident, whether they have experienced a rape or kind of any sort of abuse, there should be that exposure to the trauma. Another thing is that there's a re-experiencing of the event. And so what that means is that sometimes you find that this re-experiencing of the event, it can be while they are conscious, or it could be while they are even sleeping, in the form of nightmares. I think we've heard the stories of veterans or men in the army who have killed even loved ones, because they were experiencing PTSD. And at the moment, what happens is that they are taken back to that traumatic experience, and so if it's war, they feel like they are back there. The re-experiencing of the traumatic event tends to happen either while you're awake or while you are sleeping through the form of nightmares. Um, so with PTSD, another thing that you also tend to see is that there's avoidance and numbing. So if there's anything that is related to the trauma, if there's anything that's triggering, a trigger basically is anything, any event, any sort of of or situation even that reminds you of the trauma that you have experienced. So that's a trigger. And so sometimes you find that people avoid anything that might remind them of the trauma that they experienced. And sometimes you find that there's that numbing, like they can't feel. And this is also, the numbing is associated with dissociation. And when we are talking about dissociation, it's basically a sort of experience where you're almost sometimes it's like you have an out of body experience, like you are not really present, and you feel like you're like really not attached to your body. Almost, it seems like the events that are surrounding you are not real, so it really makes you not present, like you seem almost like a zombie. And when you experiencing those dissociations, of course sometimes it can get so extreme, that people actually form new identities just so they can avoid the trauma, or any sort of re-experiencing of the trauma. Then we have the negative alterations in cognition and mood. Here, that's where you actually find that there are people who you can be a little bit depressed. You can be depressed, and in your thinking, you can be a little bit more anxious. You can feel that stress. You can feel, that like there can be feelings of guilt and all of that. Then we also have the hypervigilance and arousal. And so what happens here is that the person is always on alert and for any kind of danger. They walk into a classroom, for example, and they just don't sit anywhere. The way maybe anybody in a classroom might be comfortable just sitting anywhere, but they kind of place themselves in a way where maybe if they can really get close, they can run away. If anything happens and they have to run away or exit the room, they can quickly do that. So they are really always on hyper alert for any sort of danger that might happen. And of course, the duration, like I said, is for 1 month or more. And then when we are looking at this, the significance of the distress or the level of distress that the person experiences, you can imagine that this is going to be very significant, such that they may not be able to do what they need to do on a day-to-day basis. It might be very difficult to get to work, especially if maybe it was an accident that you were involved in, and so then that might impact your job, and you might lose a job. And sometimes too, if we have some sort of sexual abuse, then it's also impacting the way you relate with another person in a romantic way. Um, I have known some people who have really undergone some really significant trauma, and they just didn't want to get married. They just could not, imagine that they can have, that marital pleasure when it comes to being married. And so the significance of that can be diverse and serious. So now let's look at some of the features of trauma. I have already basically mentioned some. There's the avoidance and the dissociative symptoms, which I already talked about. The anhedonic and dysphoric symptoms are what I was talking about when we are looking at the loss of interest in the things that you used to have interest in or take pleasure in. Is basically that depression that can set in. The trauma can have, anxiety and fear-based symptoms. What keeps you hyper vigilant, for example, the nightmares that a person can experience. All of these are anxiety and fear-based. But one thing that might not be as commonly known is the angry or aggressive symptoms that can also come out of, be as a result of trauma or come out of a traumatic experience. And so sometimes this is a way to to handle all of these different confusing crazy emotions. So you find that somebody has gone through a traumatic experience and they are just really angry. They are just really angry. They are mean. When you look at the way in which they relate with other people, it can be difficult to even feel some sympathy for them. But then once we're able to just put on a different lens and understand kind of where this might be coming from, then we can have a little bit of compassion for someone who has gone through a trauma, and um, how it shows itself can be really diverse, and one of it can be through really being aggressive and also being really angry. So let's look at some of the causes and risk factors. We have already discussed some. Abuse. If you have been in an abusive situation, you're likely to um, have PTSD. If there's been neglect, especially during your childhood years, and growing up and not really having that attachment figure, like not really having that parental figure, that caregiver, that you can really connect with, that can lead to you developing PTSD or traumatic symptoms. Loss, loss of any kind. And when we're talking about loss, it could be maybe loss of even something that's physical to you, maybe loss of a limb, for example, loss of your sight, for example. These kind of losses also can bring about, those feelings of, that emotional response, traumatic emotional response. When someone does not have, the support that they need after a traumatic event, it can make the experiencing of the trauma, it can make it worse. The outcome of it can be worse. Dealing with it, being able to overcome it can make it a little bit more complicated. If you have a history of a psychological condition, it makes you more likely to experience PTSD, for example. Um, if that is the case, a history of substance abuse. So if you have a history of in a situation, possibly experience a traumatic event, which can then lead to you having PTSD. But when it comes to substance abuse as well, sometimes that can be a way in which people cope, which might not necessarily be a good thing. So we'll look at that when you're looking at coping. Personality factors. There's been research that's been made, and it's one of the some of the research out there says that those who are high in neuroticism, tend to have more of a difficult time recovering from PTSD, than the average person, or it makes it more likely for you to experience PTSD than other personalities. So now let's go to the main events, coping strategies. I have really taken my time up until now because traumatic events and they don't know why they're experiencing some of these things. Sometimes all of a sudden after the event, there are those mood changes which could even include like being really angry, unexplainably angry. It could include being depressed. It could include those avoidance, and you can imagine how a person almost has to change and become different as a result of the trauma that they experience. And for some people, it's just bewildering. What's happening to me? I don't know what is going on. But once they become aware that they are going through a post-traumatic sort of like experience or emotional response to the traumatic events that happened, then that can bring about some relief. So information, awareness, that is really one way to start that healing process, because if you don't even know what is going on, it can be difficult for you to first seek help, and then it can also be difficult for you to try to do anything about it. You may think you are going crazy, and for some people it is possible that they even commit suicide. Another thing that one needs to be aware of in coping with, PTSD, for example, is to be aware of your triggers. What are some of the things that kind of take you back to, that traumatic event? And what are some of the experiences that you may have with other people? What are some of the things that you may see? So I was talking about triggers and how um, it's important to um, know some of the things, the events, the situations that basically cause you to um, be back or re-experience the traumatic event. And so, once you know what your triggers are, it's important to identify them and know them, so that you have an understanding of how to deal with it. So if you are going to possibly enter into a situation that might possibly be triggering, then you know that you have to prepare for it, and you have to also know how um, the kind of cognitive reframe that needs to go on, or what you need to be able to tell yourself about what the triggers are. So when I do therapy, some of the things that I have said about what triggers are, it's like triggers um, are kind of like a shadow, if you can almost imagine, if you can imagine it. It doesn't have the power to hurt you. A trigger doesn't have the power to hurt you, but it can be really scary. It can be really scary. It can almost make you feel that you are back there. And so then it takes you back to wanting to avoid the whole process in the first place. But it's really important to know what situations, what events, what people, what maybe even people can be triggers. And so how can that like how can you basically prepare for that so that you can still function, so that your life is not really so affected by this trauma that you have gone through, or that individual has gone through. Triggers are not something to basically run away from. It's something it shouldn't be something that you basically make the center around trying to put in that you can go through those moments where you are examining your beliefs and thoughts about the trauma. traumatic event is something that way to kind of examine talk to other people to see whether the thoughts, the beliefs that you have about the traumatic event it's real. And sometimes there can be a lot of guilt that comes out of going through a traumatic event. There can be that belief that, well, nothing good will ever happen to me somehow. And so, really examining some of those beliefs and some of those thoughts about that traumatic event is a way to heal. As part of the healing process, the coping strategy when you are looking at trauma. Stress relief mechanisms are important. What are stress relief mechanisms? They're basically, some of the things that we do so that we can distress or remove some of the load or burden from ourselves. And when I'm talking to clients, I like to say that the stress relief mechanisms that we engage in, it also has to be, you know, um, it has to be something that is um, within your budget, so to speak. So not everyone can hop on a flight to Dubai to distress. However, sometimes if it's possible, if it's safe, you can just go for a walk if you need to. And for some people, it's just reading a book and maybe watching a movie. Of course, there are some movie scenes that can also be triggering, so it's also important to look at that. It could be going for a swim. It could be just be anything that you engage in that really reduces the stress. It's important to sometimes just relieve that load by talking to someone who can really support you throughout the process. And this is not a process that you need to do alone if it is difficult. Um, so another way that people also cope with PTSD is, I think, as you can see in the image on the right, the one that I haven't discussed is journaling and writing down your feelings, writing down how what you're experiencing. It's another way to basically just offload of the burden. It can be very cathartic, which basically means just releasing that burden. It can sometimes you may not really trust the people around you enough to really share everything that you are feeling about what you're going through, but then to have your computer in front of you or to have a book in front of you that you can basically like really write everything that you're feeling can also be healing as well. And we also have another part of that is really to address feelings of dissociation that can, PTSD. So, it brings you back to your body, so to speak. And sometimes, if you're a Christian, you can be really afraid of the whole idea of mindfulness and then doing meditation. But there are Christian ways to also do that if you're a Christian. For me, one of the things that I've recommended to people who, um, you know, are Christians and who need some sort of like quote unquote mindfulness technique. And one thing is um, just listen to Stephen Furtick. He has this encouragement piece. Like he just basically, it's an encouragement piece. It's really calming. When you listen to it, like it can just really make you feel like he's reading scriptures, making declarations in a very soothing voice and a soothing tone. And so some of these things are not things to just basically run away from, depending on your background, your values, your beliefs. There are ways to implement some of these strategies. So I'll conclude and basically say that healing is possible. Sometimes when one is going through that traumatic event, it seems like it will last forever. It seems like there is no way out, but healing is possible. But once we understand what healing is not a one-time event. Especially when it comes to PTSD, you don't say that, oh, yes, I've totally recovered from it. Sometimes it might be a journey. From time to time, you may find that you are struggling with whatever it is. You may find that you have like a few symptoms, that you may be experiencing from time to time. And so when that happens, it will be wrong to think that you are not healing. Healing is possible, and healing is a journey. It's not a one-time event. Help is also available for those who are going through, trauma. It's um, you know you don't like those, like, you don't have to go through it alone. Find people that you trust, and also know that you can receive help, even if it's going online to find some strategies because you don't as yet feel comfortable, doing that. You can do that. I believe that Dr. Akapo has presented information on how to, during the last his last presentation, help you know how to, find good information, reliable information. And so we can use that to find really good, reliable information and know that help is available. Also, knowing the signs, information, awareness is key, which is why I went through, all of that before we really went into how to cope. I'm looking forward to getting more specific questions so that I can help, talk more about that. But knowing the signs when it comes to feeling like having a traumatic, experience is key. And then seeking help is nothing to be ashamed of. If you need the help is available, and reach out for it. Thank you.
Okay, thank you so much. Thank you so much, Doc. Ah, that was a lot to take in. Thanks so much for that very, very informative presentation. Um, Personally, what stood out for me was what you spoke about on was it transgenerational trauma, the fact that it's possible for
Intergenerational.
trauma to be passed down through generations, and I
Mm,
feel that's serious because, and I think it's important that you make sure that you manage your trauma, so that you don't pass it down through the generations. So
yes.
yeah, I think that really stood out for me. And I like what you said about the fact that you can exhibit symptoms and not necessarily have a disorder. You can
Mm,
exhibit symptoms and not necessarily have a disorder. I would love to ask a question on that later on, but I've seen that there's a question from Jennifer Asibe in the in chat feature. She asked, how long can one know or realize if he or she has an acute traumatic disorder? So that's a question. How long can one know or realize if he or she has an acute traumatic disorder? I think you mentioned a time frame, so I think she wants to confirm. Yeah.
okay. Okay.
Yes.
Okay. So once you it's from basically 3 days to let's say 28 days basically. So it's right up to like a month after the traumatic event. But then once you hit a month and then you're still having those symptoms, then we are looking at it being more of a PTSD than acute stress disorder.
Okay. Um, does anybody else have any questions to ask on Dr. Owusu Roberts' presentation? If you do, you could raise your hand and then I'll grant you access. I saw a couple of hands up earlier on. If you have any questions, you can raise your hand. Okay, somebody has dropped a question. Agnefa Idira, she wants you to take that again. Okay, so I think it wasn't clear. She's asking you to take that again, your submission on acute traumatic disorder.
Okay. So well, there's two things. Just to clarify, there is post-traumatic stress disorder, and then there's the what happens before that is the acute post-traumatic stress disorder. But then there's also acute trauma, and then these two are different. When we are looking at the acute, like post-traumatic stress disorder, this is basically those like emotional experiences that you have, which I some of which I talked about when I was talking about the PTSD symptoms. There, the re-experiencing of the trauma, the dissociation, the hypervigilance, the depression, the lack of concentration, the anxiety, all of these symptoms which are a response to the trauma. Once you are diagnosed with acute post-traumatic stress disorder, um, these are symptoms that arise very early on, after the trauma has happened. So we are looking at these symptoms developing from about 3 days to the 28 days, or from the traumatic event up to a month. But once you hit that 1 month, if you continue to experience, these symptoms, we say that from 1 month going, we say that you have PTSD. Okay. Then there is acute trauma, which is separate. So acute trauma is basically when you have experienced a single isolated traumatic event. I talked about different types of trauma, and one of it is acute. We have the complex trauma, big trauma, small trauma, intergenerational, and all of that. Acute being the kind of trauma that one person experiences when they have one basically isolated traumatic event. But with acute post-traumatic stress disorder, you could experience any of these 2 types, 7 types, of 3 types of traumas, but then it's the response of it and how long it lasts that basically differentiates it from full-blown PTSD. So I hope I have clarified that.
Okay, I have a question, Doc. You mentioned that losing someone close to you, maybe a friend or relative, is a traumatic incident. And I wanted to know, do you have any specific tips for uh, people who might have lost a loved one and yeah, I feel are going through traumatic experiences and are trying to cope? Do you have any specific coping strategies for such people?
Okay. So when it comes to the loss of a loved one, a relative, so it's really how you make sense of, the loss. That's one of the things that you really have to look at. Once you come to, you go through a lot of processes. That loss can also come with grief, and so making sure that you are going through the processes and not avoiding, the feelings that are associated with that is important. So, first of all, do not run away or try to avoid the feelings that are coming that come with it. That's one. Two, being able to go through the process so that you can come to a level of acceptance. Sometimes it depending on your faith level, that might also help you overcome that. And also, sometimes you need to be able to talk about the person who died. If you are there, finding someone that you can talk to about, oh, I really miss this person. This person was so and like, and memories about that person, all of these things can help. So how we cope with some of these like a traumatic event like that can be very individual. Some people can't even look at pictures, some people can't um like for some time don't want to um you know do all of that, which is fine. But then if it's becoming an issue where it's starting to affect others, and that's when you have to really make sure that avoidance is in certain areas. in. So making sure that you are not doing that avoidance in a way that is becoming unhealthy. It's affecting your life, the life of people around you. That's one. Making sure that you get to a level of acceptance, and then and then looking at how maybe like your faith example, for example, can also help you through that process. And if you need to also really talk to a professional or a counselor, that's something that you can do.
Okay, thank you. You mentioned avoidance, and I think you also mentioned earlier in your presentation that some people tend to avoid triggers. They avoid situations that remind them of the traumatic experiences that they've encountered. And I think you cited an example of people who have been through maybe abusive relationships. You know, they tend to sometimes decide to avoid such experiences. They perhaps they vow never to, like you mentioned, never to be in any relationship or marriage again to prevent themselves from being hurt. So I'd want to know, what would you say to somebody who perhaps finds themselves in this situation? They've been through some traumatic experiences, and they want to they want to avoid a repetition of those experiences. What would you say to such people? How do they do?
Um,
Yeah, I don't know if it's
yeah.
clear.
Oh, yes, it's very clear.
Okay.
When like in such a scenario, I want to know whether it's the trauma speaking or is the individual just making a decision that, you know what, maybe I think marriage is not for me. I've done it, I've tried it. Yes, I understand that, what I went through is not everyone's experience. I understand that, yes, I may actually end up having a good experience when I get married again. But you know what, I think for now or in the foreseeable future, I just want to be alone. Maybe that will change, maybe that won't change, but this is just a decision that I made. And that's very different from I went through a traumatic experience. I don't want to go through a traumatic experience again. I will go through a traumatic experience. I'm very likely to go through a traumatic experience. And so because of that, you know, I don't want to enter into another marriage. And so, and those two scenarios are really different. With one, you have made that decision, and with the second, it's really the trauma speaking. And so because of that, you want to be able to try to really work through that trauma, so that if you're going to be making any life altering decisions, you are making it because you are making it and not a trauma.
If you have any questions, please, you can ask your questions. You can drop them in the chat box, or you can raise your hand and then I'll find a way of granting you access. Okay, so I've added you as a co-host temporarily, so you could ask your question if you can hear me.
Okay,
The
okay. Doctor, good evening. Thank you
Good
very much.
evening.
Yes, that was very, very, very helpful. My
Thank you.
question is kind of long a bit. That's why I didn't want to drop it. And it's very close to what the gentleman just asked. It's very personal. I went through a childhood something, and as I'm growing up, that thing keeps bothering me. So I find it difficult to even make friends because I'm afraid in case I get close to people, I'll be having that traumatic feeling might crop up, and so it puts me in a very I wouldn't say defensive, but I'm always on edge. I'm like, I don't want to go close. So I don't know whether it is a traumatic feeling I'm going through that is making me always feel isolated or whatever. I need an answer to this. Is it okay that I am on the preventive side, or there is something I need to do to break out with regards to that hold? Thank you.
Thank you very much for your question. So um I think one question I would also ask out of that is, so one, how is it working for you? This barriers that you have put in place, are you comfortable with it, or do you feel that you really do wish that things were different? If you wish that things were different, then then it's talking about, then we are really looking at just how much the trauma is still affecting you. Because I mean, from what you're saying, you have connected this behavior to the trauma, and sometimes the danger of that is that when you are being very guarded, you keep bad people out, but then you also keep good people out. And so, ideally, the parameters for engaging in a relationship should not necessarily be connected to, the trauma. The trauma makes you aware that this is a possibility. However, um, it shouldn't be the guiding principle, so that you are keeping good people out too as well. And so for that reason, I would say maybe a healthy way is to really identify good parameters. Okay, so who gets to be in my circle and who doesn't get to be in my circle, and use assumptions. Is it like fear based, or is it a decision based? I'm going according to the parameter that I've set, which some of the ways that you can see how it's impacting you. But then if you're okay with then for now it's something that maybe you are aware of. But then if you are concerned about how it's going, then that's when you have to really try to consciously work on it, so that you are setting healthy parameters that is not fear based, but which is really, this is Seward, this is who gets to be in Sarah's circle, and this is who doesn't get to be in Sarah's circle, like the average person would.
Okay, thank you. Thank you, though.
You know,
Okay, so if anybody has any questions, you can drop your question, as I've said already, in the in chat box, or you can simply raise your hand up and I'll grant you access to ask your question. Any questions on Dr. Evelyn's presentation? She spoke at length on trauma, coping strategies for trauma. Any questions maybe running through your mind on the topic, personal experiences you'd want maybe some insights on? Okay, so whilst we wait for further questions, Doc, I have a lot of questions. One more question. You spoke about PTSD, post-traumatic stress disorder, and I think you mentioned one of the symptoms being flashbacks and all. Um,
mhm.
I'm wondering, I'm trying to connect that what you said earlier on about the fact that somebody can experience symptoms of trauma and not necessarily have a disorder. So at what point does a person, or will a person know that the person has a disorder and not just simply a symptom? For instance, maybe the person had a bad violent experience and now the person gets flashbacks every now and then, random flashbacks. Okay. Um, at what point will the person know that, okay, this is just symptoms and not a disorder, or this is something that perhaps you need to seek clinical attention for? You can speak on that.
Okay, thank you for your question. Ideally, it really depends on the severity. The severity of the symptoms will let you know whether it's PTSD, or it's just you experiencing symptoms, a post traumatic symptom as opposed to a post traumatic disorder. But ideally, it is a professional, that does a diagnosis of a disorder. It is not advisable, for any individual to self-diagnose, because the professional is trained to be able to determine the difference between the two. And once you get that official diagnosis, for some people it has like a lot of repercussions, depending on the country you're in, and all of that, and access to health care, like so many things. But basically it's a professional that will diagnose you with a disorder. But then once you have the symptoms, and if you are concerned enough, that official diagnosis can be done once you seek help from a professional.
Okay. A follow-up question. Can you speak on the state of therapy services in Ghana? You've mentioned the need to seek professional help, of course. Can you speak to that? Because for some reasons, I don't know if we have a lot of therapy providers in Ghana. I don't know, I may be wrong. And the few experiences I've heard about and I've read about online, for instance, there was a lady who spoke about her experience with a therapist. She went to see the therapist, and I think she shared her pain with the therapist, only for the therapist to start literally laughing at her and tell her the problem is not any big deal. And she shared this on, I think, was it Twitter? And it generated a lot of conversations where people shared similar sentiments, of their experiences with therapists in Ghana. So I don't know if you can speak on that. How is the state of I don't know the right word to use, but therapy provision, psychotherapy services? Are there any providers you would recommend? Are there any maybe tools or platforms, online platforms? I think I saw an app or so that allows you to connect with therapists all over the world. I don't remember the name. Would you recommend such platforms? I think I also saw a specific platform for Christian therapists. If, for instance, your beliefs is you're Christian, you can be connected with a Christian therapist, for instance. So I'd want to know, are there any such platforms locally, and therapy providers that you would recommend? I know you're a therapist, right?
Yes, and
Yeah,
recommend myself because I'm very professional.
that's and that's
But
the more reason why I think all of us should be very engaged in this conversation. Dr. Evelyn is a professional clinical psychologist, a trained therapist. So this is more or less like a free 1 hour, consultation. So this might go for questions. Any questions on the subjects we've discussed? Yeah, anything
yes,
might
but
be related.
yes, but to what you just said, the scenario that you gave, unfortunately, like for someone to laugh at a client like that, that is very unprofessional. And those who have not training. And even when you look here in Ghana and we look at, training is done abroad, Ghana, and very good ones too as well. Some of the things you'll see, especially if someone is trained here. And of course, they don't also take seriously, what they have learned. So that's a very unfortunate circumstance. But there are other professionals here, and sometimes if you just reach out to one person, they can make those recommendations. The Ghana Psychological Council has a list of all licensed, psychologists. And if there's any non-professional or unprofessional, conduct, you can report it to the Ghana Psychological Council too as well. So just to put that out there.
Okay. All right. One more question, and I think we'll wrap up. So, There's someone on this call. I'm sure she would want to remain anonymous. I wouldn't want to put her on the spot, but uh, well, I've told her I'll be asking this question on her behalf because she couldn't muster the courage to ask. She says every now and then that she has social anxiety, so she avoids, for instance, public speaking. She avoids uh, gatherings, and yeah, I know this isn't trauma per se. I don't know. Maybe it might have a trauma implication, but do you have any tips that you could share for such a person who says she has social anxiety?
Okay. So if someone has social anxiety, it would be good to work with a professional through that. However, the tips that I have, one is to take little steps. So, for example, if you're afraid to be out, in public, um, you know, you could go out with one person that you trust and feel comfortable with, just so you're out, but then you feel safe, you feel comfortable. If you are afraid of doing presentations to a whole group of people, maybe you could try with doing presentation with one person that you trust, that it's going to give you maybe positive feedback. Another thing is to really look at how, like the thoughts behind the anxiety, being able to test them and question them. Is it true? Is it real? What are some of the what are some of the evidence that supports what you feel? Because sometimes what people think, the fear that they have, is just fear based. It's not based or rooted in reality. And so some of those thoughts seem very real, but then there's no evidence to back it. So I'll say, look at your thoughts, look at your beliefs, just take small steps with people that you're really comfortable with. And then from the small steps, take slightly larger steps. And every time, sometimes preparation also helps when it comes to like doing presentations. So you can also do the rehearsals, also help. So these are just a few tips for that.
All right. So thank you so much. Time is fast spent. Could you share any concluding remarks on your presentation? If there's one key takeaway you'd want to maybe leave with the audience on the subject of coping with trauma, is there any key takeaway you'd want to share as your final statement before we wrap up?
So I think, the last thing I'll need to, the last thing that I'll share is basically like a re-emphasis of my conclusion, which is that just be aware of the symptoms, whether it's in you or in people that you know. And also, once you are aware of the symptoms, try to also be a support if you know anyone who's gone through a traumatic experience. Healing is possible. There's no shame in seeking help. And you know um sometimes the feelings of guilt, that is attached to it, the shame that is attached to it, the mindset that can be attached to it, sometimes they are not real. So some of the coping strategies that I have recommended, I would ask that you put them in place, and then if it seems overwhelming, just reach out and seek help. Thank
Okay.
you.
Somebody has dropped a question. He wants to find out if it'll be possible to get your slides, your presentation.
Yes.
Okay. All right. So if you can hear me, you can perhaps drop your email address in the in chat box, and we'll find a way of sending Doc's presentation to you. Okay. So I've seen Agnetha Indira has her hands up. Okay. All right. I've seen your question. Sorry, I missed it. Can you explain the dynamics of experiencing pain during sex after a bad first experience? Can you include a coping strategy for such a person? So let me ask the question again. Can you explain the dynamics of experiencing pain during sex after a bad first experience? Can you include a coping strategy for such a person?
Okay. So yes, I have worked with someone who has undergone, who went through sexual abuse, basically. I think because
Okay.
I worked with her for like a long period of time, she's like my most success, like she's a success story, because when I started with her, she did not want to get married. She was afraid of sex, and then now she's married and has a child.
Wow.
But one of the things that you really have to go through the process, because it's really a cognitive thing. There's so much thoughts that come associated with sexual abuse. The self-blame, the feelings of guilt, that I should have, if only I had done this. And so then the guilt is something like it's a whole work on its own, looking at the guilt. Then we also look at, okay, some of the feelings and the thoughts, the fears, associated with, having sex with, your husband. And then being able to work out repeatedly the difference between someone who touches you to harm you and someone who touches you to love you. And that's also like a mind shift that needs to happen, that you have experienced, one thing in the past which has not been positive, but what you are about to experience is different, is not the same. What you're about to experience is not to harm you, it's not to hurt you, it's not to basically be a repetition of what has happened in the past. So the really understanding the differentiation also between the two, a touch of hurt and a touch of love. All of these things are some of the work that needs to be done when it comes to like a situation like that. So really being able to understand the difference and be able to work out, some of the thoughts and feelings and the guilt behind what happened in the past, and being able to kind of like resolve it too as well. So um yeah, that's what I would say.
Mhm. Okay. Thank you so much. I've seen some more submissions in the chat box. Okay, so we have a comment from Nodomo Dlamini. Okay, Nodomo Dlamini. Pardon me. Okay, she says, excellent webinar. Thank you very much to the speaker and organizers. Very important topic. Thank you. I don't know if you'd want to maybe share any remarks. If not, that's fine. Thank you so much for connecting. Okay, so I think he's all right, sure. Okay, so Doc, thank you so much for your time, for your presentation, and for taking time off your schedule to share all these insights that you've shared on coping strategies and on I keep mixing the webinars together. We've had so many webinars. We had anxiety last 2 years, so trauma, your strategies that you've shared on coping with trauma, and thank you for not holding back your insights, your experience, and your expertise. We're so grateful for your time, and I think we'd have to probably do a part two if you would be able to make time once again for us. So thank you so much. It's been very insightful, very impactful. I love how you combined your practice, your experience from your practice, and also the theoretical aspects of mental health and uh, the subject we just treated. So thank you so much, Doc. We're so grateful. So at this
Thank
juncture,
you.
sorry.
I was saying thank you too.
Okay, thank you so much. Okay, so I've seen a message from Prof. Samolate. He says he couldn't talk because, okay, he's been deactivated. Okay, so sorry, that's my bad. So let me add you as a co-host quickly, so you could share maybe some closing remarks, and then we end this session of the webinar. Okay, so he has shared his take on what's up with me. He says he really appreciates the presentation. It was very worthwhile, and he wants to convey his deepest gratitude to our speaker, Dr. Evelyn Owusu Roberts. Thank you once again. All right, so time is fast spent. Thank you so much, everyone, for connecting to this third edition of the Mind and Heart webinar series. We're so grateful for you participating and taking time off your schedules to be part of the webinar. With so many things, fighting for our attention, it means a lot that you took time to be part of the webinar. So you helped make it a success. And our next webinar session would be on the 14th, April 14th. It'll be with Dr. Mabel Otibwedi, and she will talk about navigating the challenges of life, suicide awareness and prevention. That's Dr. Otibwedi. She's a senior lecturer at the University of Ghana, Department of Psychology. Okay, so thank you once again. Thank you, our technical team, Enoch, for your support behind the scenes. I'm so grateful. And thank you, basically, everyone, for connecting. So hopefully we connect once again. So try and stay in touch with us. You can check our social media handles for any future announcements on future webinars. So that's Regent University College of Science and Technology on Facebook, Regent Gram on Instagram, Regent Ghana on Twitter. So you can connect and then you get information on any